when you're working in a surgical setting, you want to have a back table. I'm just going to use this because if I'm scrubbed in, I'm not going to be able to open up or even pick up the package, right? So I'm going to clean my area, starting in the middle, just like we did for the Mayo stand, right? Make sure any dirt on there gets swept out to the outside. Okay, gown package like this. They're pretty standard. Surgical gown. And then I have sterile gloves, right? So the outside of this package is not sterile. The outside of this package is not sterile, right? But inside it is. So I have to be careful about the way I open these. Remember, I'm not scrubbed in yet. I'm just preparing my back table. So, you know, in a surgical setting, you might be the person who prepares the back table, or you might be the person who's scrubbed in that has to come and get the stuff on. So I'm kind of playing both roles right now. So just like with our sterile wrap, right? You have an obvious little point to grab to open your gown. This one got folded sideways, but I can see that it pulls this way. Like that. So now this is a sterile field. I don't want to pass over it, so I'm going to come over here. Hold out. Okay. And then I just want to arrange this so the person who's scrubbed in can come and don it without touching anything. So see, there's a towel, and it's just totally sterile. I'm not even going to talk over the top of it. And then the gloves, just like we open the drape, right? Okay, carefully with the corners. Look carefully at the corners, and you're just going to open it like that. Put it in your field without crossing over your feet. Just scrubbed in. Now I'm all wet. Okay, so one thing, see me? I am holding my hands above my waist. That's very important. Okay, I'm coming through doors, using my backside. Okay. Okay, I'm not touching anything with my hands or with my arms. Approaching my back table, I'm not going to turn my back to it, okay? This is my sterile area. I can't turn my back to it. Okay, if I need to move something around, do it with my foot. Something out of the way with my foot. Okay, no touching anything with my hands or my arms. And I'm all wet, so what I need to do first is towel off. So I'm just going to grab this towel. Here's a question. I just scrubbed in. Am I sterile? No. But I'm as clean as I can get. Alright, toweling off. Right, distal to proximal, right? Distal to proximal. Okay. So I'm not going to pick that up now. Okay, so I'm gonna don my gown and gloves. What I just want to do is, it should be laid out like this. So this is the inside of the gown right here. So you can touch here, lift, just like that, right? I'm going to keep my hands inside my cuffs. I'm not bringing my hands out because I'm going to put my gloves on a special way, using it with my hands inside my cuffs. And so in surgery, you usually have a helper. You'll have someone to grab that tag and spin. So we already talked about how I'm scrubbed in, but my skin is still not sterile. This gown is on the outside, right? So I can touch things using these cuffs, as long as I keep my hands on the inside. So that's how I'm going to put my gloves on, right? Open the package. And I have right and left, okay? Be careful about what kind of gloves you use. As you can see, there's different sizes, and with sterile surgical gloves, it's not just small, medium, large. There's a number. So I'm usually a large. I wear a 9. There's 9s, 8.5, 7.5, 7s, 6s. And this is for our class. So this 6 to 9 pretty much covers everybody. There might be larger sizes. And watch out, because some of these are still made out of latex. These are latex. These are latex. These are something other than latex. So what you want to do is, one way to do this anyway, if you can get the glove on, just grabbing the cuff and pulling it over, you can. But one trick is to put it on your hand facing you, like that, with the thumb on the side that your thumb is on. So my thumb's out to the right, thumb's on the right side, and then you can grab one side of the cuff with this hand, and then you can grab the other side with this hand and pull it over, like that. Right? Then you can work your hand up into there. Like that. And then the other side is a little bit easier. So it's going to face me, right? So the fingers are pointing towards me with the thumb on the outside. So grab that, pull it over the top like that, and then work your hand to there. So now I'm sterile on the outside, and I can use my hands. So see how the glove is still way up on my palm? That's good. Creates a nice overlapping barrier. Cuff of the gown well up my hand. And I have long arms, but see, I can still at least have extra long sleeves. And I'm scrubbed in. I'm gowned and gloved up. We don't have surgical caps here, but you definitely, the first thing is to make sure that your hair is covered. One additional note here is on the order of PPE for donning and doffing, and that's important. So at this point, if you need to put on a shield or goggles or anything like that, you're going to have someone put it on you, because you're sterile on the outside now, so you don't want to just grab stuff and put it on.